Hello and welcome to Healthy Cleveland. I'm your host, Dan Monroe. Today we're talking about indoor air quality, and we're going to learn ways to make your home air healthy and some of the different contaminants that might be invading your home. My guest today, Yvette Mitchell, Outreach Environmental Program Manager with the Department of Public Health, and Dr. Daniel Onwuka, Indoor Air Quality Specialist. Folks, welcome to the show.
Thank you for having us.
Thank you for having us.
Yvette, we've spoken with you before, but talk about the Indoor Air Quality Program, everything going on in public health. Tell me about that whole department.
Okay, so we are with the Cleveland Division of Air Quality, and the Indoor Air Quality Program was created in 2018 in response to complaints that were coming from residents, but there was no one staffed to respond to those complaints. So we created this program so that we can respond and get the complainants the resources that they need to resolve their issue. Mm-hmm.
Now, Dr. Onwuka, I understand you're 6 months with the City of Cleveland. Welcome to the city, by the way.
Thank you.
Tell me about your role as the Indoor Air Quality Specialist. What do you do on a day-to-day basis?
So my role involves to work to ensure emission and other airborne pollutants do not violate the federal and state laws, and also to attend to complaints regarding the indoor air quality, and also to respond to complaints. Also, to conduct minor investigation pertaining to indoor air quality problems.
Why, though? Why should we be concerned or take notice of the air quality in our homes and workplace? Why should that be in the back of our heads?
According to the U.S. EPA, Americans spend about 90% of their time indoors. So that's between home, work, school, church, any indoor setting. Sometimes in those settings, the pollutants can be 2 to 5 times higher than outdoor air. Because we spend so much time indoors, we don't always think about the quality of the air indoors. So why people should be concerned about indoor air quality is because what goes on in the home impacts your health.
Well, Dr. Onwuka, what are some examples of some air contaminants or contaminants that we could have in our homes that we don't even know about?
Yeah, that's very amazing. People are not aware that there are so many air contaminants at home because people think about the outside, but they don't think about the inside. Mm-hmm. For example, when we think about the tobacco smoking, people smoke in their house, most people smoke in their house, and sometimes people don't understand that even if you don't smoke, there's something called secondhand smoking, and that can also impact your health. Mm-hmm. And also, we also have volatile organic compound, VOC. These are things that give off gassing. They can be found from tables, flooring, the furnitures, and all those things. They give off gases, and they can impact the hair. Also, the radon. It's from the soil, but it's something that can affect the health through the cracks. It comes through the cracks of the wall and affect people. And also carbon monoxide. Mm-hmm. Because it's odorless, it's colorless, people don't even understand that this can also impact and even cause death to some people. And also we have microorganisms, the mold, the bacteria, and because most of these things, they survive where there's moisture. Mm-hmm. So when you have moisture around the house, mold can grow and impact the health. And also we have things, the solvent, things we use like bleach, things we use for washing of things in the house, solvent. Those things can actually impact the air quality at home. And also we have building materials, the cleansing agents. We also have the furniture, just like Mitchell said, in the house. Mm-hmm. These are things that can impact the air quality at home.
Maybe if you have a wooden a drawer and then you go to lacquer it or something like that, poorly ventilated.
Right.
That's chemicals.
Yeah.
Chemicals, a lot of toxic chemicals.
Well, let's look at a couple of things you said. Smoking being the biggest one. I've been to houses where there's smokers.
Yes.
You can see the discoloration on the walls, but you can also smell it in the air.
Yes.
Mm-hmm.
So if you smell it, even though it's, it's still going in your lungs. If you can smell it, it's going in your lungs, right?
Absolutely. We say that there is no safe level of exposure to secondhand smoke. So if you're inhaling it, you have the potential to develop sometimes of long-term effects, some health effects. So if you're not a non-smoker, but someone in your home is smoking, you're putting those non-smokers at risk because anytime they inhale that, their health can be impacted.
You mentioned one thing too, radon. I just learned about radon recently because I had a test done at my home. Okay. We actually did it with our whole family. We did tests. And my radon levels were over 11% or something. They installed a whole a whole device. I didn't understand what it was, but it's sucking the radon away from the house. Talk again, what is this radon, and how come it affects different houses differently?
So it goes on the ground. It's a substance that's in the ground. It's hundreds and thousands of years old. And the way that the earth forms and shifts, that has an impact on why your neighbor level could be high and your level could be low. And so what we recommend is that the occupants of the home have their home tested for radon. Radon can seep through cracks and crevices in the ground. And so we would have you put a test in. You can get it at Home Depot or other big box stores. And it'll stay for a couple of days to get the reading, and then it'll give you instructions on where to send that to have it tested. Based on those levels, like you said, they'll recommend whether or not you'll need a device to bring the radon away from your home. But long-term effects of that could lead to lung cancer if not addressed. And it's not something that you would smell or see.
That's what they told me. Lung cancer could be a result of long-term.
Right.
So I got that taken care of right
away.
away.
I'm so glad for your family.
Right.
You
You can sleep a little bit better at night knowing, okay, there's something out of my house.
And you did it.
True.
You acted. So that was great.
You know, it's all about thinking of yourself and your family. You also mentioned the biggest one, carbon monoxide. I'm a firm believer that every house, however they could get it, needs a carbon monoxide detector as well as your smoke detector.
Yes.
Let's look at this again. It's odorless, it's colorless, and it's deadly. I mean, tell me about it. How can carbon monoxide build up in your house?
So there are many things that can cause carbon monoxide to build up in the house, like the stove, the gas that we use at home. Some people, I would say, they can just turn on the gas and they go inside the house to do something different, leaving it outside. So that can cause it to build. Another part again is through exhaust, like a car exhaust. In fact, recently, I think in September or August, there was a case of carbon monoxide poisoning as a result of a mother and her children staying in a car that was on in the garage. They inhaled the carbon monoxide and they were affected. So they're taken to hospital, a mother and 6 children. And there was a case also in Nigeria about a family that were completely wiped out. What happened was that this family bought a new house. When they got to the house, the first day that they went to the house to sleep, there was no light, and they decided to use generator. They didn't know that something was going to happen.
Yeah.
They slept off, they turned on the generator, and they slept off, and it was close to the house. The exhaust, the fume going to the house. In the morning, all of them were found dead.
So we would recommend, if you have a gas stove, to open your window in your kitchen if you don't have a ventilation hood over your stove, to exhaust those fumes outside the home. And again, have your carbon monoxide detector installed and check the batteries often. Really just ventilate those combustion fumes outside of the home to prevent any buildup. Have your furnace checked regularly so that, if something goes wrong with that, that's checked very often. Yeah. So really it's just really keeping a check on your home.
Getting that checklist going. Yes,
Yep.
Doctor.
Yes, and also people, especially during winter, some people turn on the car in the garage and just leave it running for a while. That can
to warm up the car.
Yes.
Yeah, always. I mean, it goes without saying to me at least, but have that garage door. We're going to warm up the car, open the garage.
Open the garage.
Let the exhaust go out.
Out.
Not in.
Yes.
You also mentioned mold. It got me thinking, I need to go check my basement windows. It's probably a good idea to look for where moisture might come in, especially basements. Unfinished basements are a big bring in lots of moisture. How can you look for mold? How can you tell if there's mold present?
So the first thing, you can see mold.
Yeah.
The black mold, check around to see, because mold actually survives where there is enough moisture, or we call it dampness. So make sure that all the places that are dampness, that they have moisture, regulate those ones, clean them up. So you can see the mold.
You can also smell it.
You can smell it also. So these are things we have to look, because someone said, if you don't look, you can find. If you don't search, you can't see. So it's for us to look everywhere in the house to see that if you can see any mold, and also smell, see if you can smell mold.
Cleveland residents who are in rental properties, if they think that there may be mold in their homes, they can call our Division of Environment. to have someone come out to check. Now, it may take about 2 to 3 weeks for someone to come out and respond, but they can have their home checked, even if it's a rental property. Non-CMHA property can be checked for to see if there's presence of mold in the home. Again, so you don't have to bring someone in to try to pay them to check for mold. You can visually see mold. You can audibly, you can smell mold. So you don't have to bring someone in or pay someone to come and identify the mold. The mold is really noticeable. If you want to know what it looks like, you can just kind of Google what a picture of mold looks like, have it identified, and then if you have a landlord or something, you can talk to them about having someone come in to remove that.
Now, those in non-rental properties, can the Department of Health give steps of where to go to help remediate that issue?
So there are some tips for them, for homeowners as well. We do not have any services right now that pays for mold remediation for whether you're in a rental property or a ownership property. But so they can contact us as well. They will be given tips on who to contact to see a mold remediator.
You did mention the furnace, and you reminded me, it's been 3 months at my house, I have to change the filter in my furnace. Why is that important to change that filter?
So those filters hold a lot of dust and particles. If it builds up, your furnace won't work properly. And so we do want to recommend a filter of a MERV 13 or higher, which is going to get those smaller particles trapped. And again, you may need to change it more frequently, but in the wintertime, we say about every 3 months. So.
Yeah, that's definitely important, because when I pull that filter out, I see a lot of garbage that it trapped, and they're like, okay, time to get a fresh one in there so we can breathe easier.
The MERV ratings are listed on the packaging, and so 13 or higher is what EPA recommends to get to those smaller particle pollutants.
Yvette, what are some symptoms that people might have that are warning signs, hey, your air quality might not be as healthy as you want it to be? Now, in my mind, I'm thinking, okay, persistent cough and then constant sneezing. But is there anything else that could be happening?
Yes, so what you mentioned those could be things like asthmagens, but the coughing, the sneezing, headaches, dizziness, shortness of breath, all those could be related to someone who has undiagnosed asthma, or if some things are present in the home that could be exacerbating a person's asthma or COPD or other lung respiratory conditions. But if you have persistent health issues in the home, we do recommend that you seek assistance from a medical provider. You can contact us to let us know, hey, I'm feeling these things, but we would always point you back to your provider to have yourself investigate a little bit further.
Best to get checked up by doctors. That makes perfect sense.
Irritation of eyes, respiratory disease, heart disease. There is a physician here in Cleveland who has linked air quality to heart disease. So depending on what zip code you live in, it's very interesting research going on over a case. So, things that we may not even think of are linked to our health in our homes. But those are some symptoms that you may experience, and then you want to have those reevaluated with a physician.
And chronic asthma, you mentioned asthma, but that kind of steps. I always thought that asthma could have been genetic, but I can see now it could also be caused by pollutants and contaminants.
You can develop it as an adult. You don't have to have been diagnosed with asthma as a child. And things that, again, what Daniel has said, that the things that are hobbies that we're doing in our homes, if the home is not frequently dusted, if there are indications of pests in the home, or if there are pet droppings, all of those things can exacerbate a child or an adult's asthma symptoms. So we would explain that you would have to go through your home, dust frequently, vacuum frequently. If you have pets, please don't let the pets sleep in the bed, and change your sheets frequently. Wash them in hot water at least once a week. Those are things that we would suggest to reduce asthma symptoms.
What's your message to people watching today? What can they do at home to improve their indoor air quality? What are some of the steps they can take?
So the first thing is to do outsourcing. Just like I said before, if you don't look, you can find. So look for the source of the problem. Check around to see if there's mold. There's this basic principle of healthy home, just like Yvette pointed out. Keep the home dry, keep it clean, keep it contaminant-free, pest-free, safe, comfortable, well-maintained, ventilated, accessible, and energy efficient. So, and also another thing again is to check, because health is wealth. When you're able to check and see the source of the pollution, the source of the problem, that means you've done great work. That means there's chance that problem may be somehow eliminated. So the first thing to do is to do outsourcing, which is the best way to handle air pollution. And the next one is to do what is called ventilation dilution. Open the windows, let there be flow of air from outside. Don't lock up the room, everything stuffy, let there be ventilation. Another thing again is to clean up the filter. Just like we said, and also Michelle also said about the filter, using the HEPA filter or MEV 13 filter that can actually remove the particulate matter of 0.3. The next one also is to get the home tested for radon, just like you did, so that people will know, because radon is a radioactive element that can actually impact health. And also install carbon monoxide. Just like we said, install carbon monoxide because it's odorless, it's tasteless, it's something that you may not even feel, you may not even see, you may not even perceive, but it goes in, combined with the oxygen, forming oxyhemoglobin, and thereby imparting the level of oxygen that's delivered to the tissue. That can be the result.
Yeah, you know, Yvette, we were talking earlier, the National Center for Healthy Housing has that whole list of keeps that you just talked about.
Yes.
You know, and I think if you go through that checklist, it's a good start.
It is.
Yes.
It's a good start to get to on your way to a healthier home.
Absolutely.
Yvette, Dr. Onwuka, what are some things that that we haven't talked about that you want our viewers to know about their air quality?
So there's some websites out there that'll give you a checklist where you can walk room to room in each room and do your own self-check. So you would go through and you would say if you were in your living room, check and see if you have blinds, are they dusty? We would suggest that you don't dry dust. We would suggest that you wet a cloth and then wipe those blinds down. We would suggest there are some recommendations that per resident of the house, so however many occupants you have in the home, that's how many times you would vacuum that week. So if your house has 5 people, you could vacuum up to 5 times that week. Just to continue to keep that home clean. We would also recommend, again, like Daniel said, open the windows. Bring some fresh air in. If you want to take extra measures, there are air purifiers on the market that folks can buy to reduce pollution in their homes as well.
You know, there's nothing better than fresh air.
Nothing better.
Nothing better. And even in our house, sometimes in the winter, yeah, it gets cold, but for a little bit, I'll open up the windows, you know, just
a few minutes a day. It does get stuffy, and then just close it back up. But, you know, just bringing in that fresh air. One of my mentors in this industry, Ian Cole, says that the solution for pollution is dilution. So you dilute the air by bringing in that fresh air.
I like that. I like that. First of all, a couple things. If people want more information about air quality and about the division, where can they go?
So we have clevelandhealth.org. They can go to our website and find us there, Cleveland Division of Air Quality. And if they want to report a concern of air quality and talk to us about it, and we can give them some resources, they can call us at 216-664-7442.
And Daniel, you said earlier you take in the reports and the complaints. Is that the number where they can talk to you or someone from your... Yep.
Yes, yes. So they're going to score that. And also, just like people are watching us, I want to say something regarding everything we said today. Always remember TRUE, TRUE. As air quality is concerned, think about the environment you are. Just like Yvette said, that 90% of our time we spend that indoor. Think, reflect. What am I doing right? What am I doing wrong? Am I the one causing this poor indoor air quality? Then use everything you had as an experience. And the last E is to educate others. Every experience you had, you may have a different experience from mine. You had radon, other people have different things. Use any experience you have to actually educate others. And that's very important when it comes to indoor air quality. And for the complaint also, just like you even mentioned, anyone is free to call us as long as you live in Cleveland. The number she has given to us today, for each time you call that number, it's going to get to us the complaint you have about the indoor air quality, and we'll do everything possible to make sure that the complaint you have is handled efficiently. Then
Yvette, we're also on social media too, aren't we, with your division? Tell me about that. Where can we go?
Yes, so we are on Facebook, Cleveland Department of Division of Air Quality, and then you can also find us on social media, on Twitter and everything like that. And for this month, the hashtag is #National Indoor Air Quality Awareness. If you type that in, you'll find more resources on that. And also the Indoor Air Quality Association at iaq.org.
All right, Yvette Mitchell, Dr. Daniel Onwuka, thank you so much for joining me today. We learned a lot about indoor air quality and things that you can do at home. Remember, just open the window, let the fresh air in. That's the first start. Get that fresh air in. Breathe it all in. It's great for you. Thanks for watching Healthy Cleveland. I'm Dan Monroe. We'll see you next time.